good people, great medicine. Penn State Hershey.
An advance directive is a formal document that tells people what kinds of medical treatment plans people would want to put in place in the event that they couldn't make decisions for themselves. The broader term is advanced care planning, which really refers to the process of decision making when somebody can't make a decision for themselves. So an advance directive could take many different forms. It could be something that people write on a piece of paper, it could be a videotape, it could be a discussion that's documented in a narrative form, it could be wishes that they write on the back of a napkin. But if something's to be considered a living will document, it needs to follow a specific, use a specific form and follow the particular state-specific guidelines. And the main goal of an advance directive really is to communicate what their wishes are, and who they would want to make decisions for them. The fact is that physicians don't necessarily know what decisions are going to be best for an individual unless they know more about that individual. What are their values? What are their goals? What are their priorities? And everybody's different. At the end of the day, a living will or advance directive is just a piece of paper, and it may or may not capture what somebody's real underlying values and goals and essence is as a person. And if you really want to make sure that your wishes are followed when you can't make decisions for yourself, the piece of paper is important, but it's also as important, if not more important, to have a conversation with your family and friends and loved ones and people who will actually be helping to make these decisions because you're not around or not available to make the decisions for yourself. And so to the extent that your family and loved ones understand you and your wishes, then they can be an advocate to help assure that whatever those wishes are get implemented by the physicians. And you can't assume that people know what you would want if you don't actually explicitly tell them. I remember once a number of years ago I had a conversation with my grandparents, who at the time were in their 90s, and they had been married for 65 years. You'd think that after all that time they really knew each other as well as any two people could know each other. But I said to my grandpa, I said, "Grandpa, if Grandma got sick and she couldn't make decisions for herself, what do you think she would want to have done in terms of life-sustaining treatment and so on?" And he said, "I don't know, we've never talked about this. We just don't talk about that subject." And then I turned to my grandma. I said, "Grandma, if Grandpa got sick and he couldn't make decisions and you had to make decisions, what sorts of things would he want to have done?" And she said, "I really don't know. These are not things that we ever talk about." And at that point, it really hit me that the fact that somebody's married to one another and that they know each other doesn't necessarily mean anything in terms of their ability to implement the plan. And so there's really no substitution for having a conversation. Yeah, so what do you do when you fill out these forms? Well, I think you need to give it to as many people who you think are going to be involved in the event that you couldn't make decisions for yourself. Living will or advance directive is not useful if it's locked up in a safety deposit box or if it's hidden in a file drawer in your house. You need to give a copy of it to your loved ones. You need to give a copy to your doctor, maybe to your lawyer, or to anyone else who might be involved in decision making, your spiritual advisor, a rabbi, a priest, a counselor. I mean, you can't have too many of these things. The only thing that is important is if you make changes, then you have to be sure to change all the documents and make sure that you get the newest one. But keeping these locked up safely is of no use if you end up in the emergency room at 3 o'clock in the morning and a decision needs to be made and they say, "Well, is there a living, oh doctor, there's a living will." Well, where is it? Well, it's safe. It's in the safety deposit box. That doesn't do any good at that point. Okay, so this is a project that I've worked in for 7 or 8 years, and I do this with my colleague Benjamin Levi, who's also in humanities, and we've come to understand that this sort of thing is important but imperfect, and the current mechanisms that are available for helping people generate living wills and advanced directives tend to be quite limited. So what we've done is we've developed an interactive computer program. It's currently a CD-ROM, but it's eventually going to be put on the web as a web-based program. And what this program does is it helps people think through the kinds of decisions that they might be faced with in the event that they became ill. And it helps them articulate a medical plan. It also provides, much unlike the standard living will forms, it provides education. And so if one decision that needs to be made is, say, to whether or not to be put on a ventilator, well, some people don't know what a ventilator is, and so we provide education. Here's what a ventilator is, here's what the risks are, here's what the benefits are, here's what the experience of being a ventilator is like. It also asks a series of questions throughout the program to help people articulate what their values and preferences and goals are. And so it goes through some values clarification type exercises. And then what the computer program does, which is quite innovative, is it takes all the information that people provide by going through the program and then translate that information and turns it into a medical plan that could be implemented. And then at the end of going through the program, it prints out a document, which is an advanced directive document that can be put in the medical records, given to loved ones and spouses. It also gives the opportunity to assign a surrogate decision maker, and this can be shared with loved ones and physicians and others, so that when and if decisions need to be made, they've got more of an idea of how to go about doing it. There's plenty of living will forms available, and if somebody just wants to fill out a form, they can go to their doctor, they can go to a lawyer, or they can download a form from the web and they can fill out a piece of paper, and that's better than nothing. I think that's a great start. Our program is not just the checklists about what decisions you want to be made, you would want to have made, but it's a decision aid that helps guide people to make these decisions. It helps them make the decisions in ways that will result in a set of decisions that hopefully are more consistent with who they are and what they actually want. Right now we're involved in a couple of different clinical trials, and the research we're doing is looking at a variety of different outcomes to see if people find this to be more helpful. Does it improve their knowledge? Does it improve their decision making? Does it lead to doctors being more informed about the decisions that patients want to have made for them? And our goal is to make this widely available to as many people as possible, because we really think it can be helpful.